Hello, this is Tamika, and I hear that you are here to see if you are diabetic. Yes. Okay. What is your name? Um, Say it again. Okay. And your age, please. Date of birth. Um, okay, and your address. And the reason you're here. Can you tell me any signs that you would think that you're diabetic? Peeing a lot. You drink a lot of water. Yeah, you think that you're thirsty more often than usual. Okay. Um, yes, that is. Some of those are signs of diabetic. So I'm just going to. So, Miss Walker, you do have the signs of diabetic. So I will have to test you, and I know this is going to be weird because it's your first time, but I do have some things here that will help you with diabetes. Okay, so scoot you back a little bit. Okay, I'll be right there in a second. Okay, I'm going to move you a little further, back a little bit more. Back to me. Now, I have some things here that I'm going to walk you through. Oh, you already had a little bit of information from your doctor? Okay. So, I am here because I'm going to be telling you what you have to do with your equipment. But first, I want to run through some books that you will have to read when you are diabetic. This book is Carb Counting and Meal Planning. This book is going to help you choose what you want to eat, and it helps you pick the right foods to eat, so you won't be so you won't have to go through a long-term diabetes. Yes, diabetes does go away, but you have to eat right in order for it to go away. I don't think you want to have it for a long time. So this is just basically to help you manage your blood sugar. I'll show you some of the things that you would have to eat. meat and meat substances is um, a good page that you can read. It tells you about um, low fat and the main ingredients that you do want to eat is greens. You do want to eat a lot of greens. Milk products. You can eat yogurt and stuff like that, but they have to have a healthy diet. Um, you do want to make sure that you do daily checkups with your doctor, and you do daily checks of your blood sugar. This is another book, a little pamphlet that helps you understand what diabetes is. It helps you track it. It helps you pretty much maintain it, and it just gives you good information about what you have to do with your diabetes. Even it's similar to the carbon and counting meal planning, but this gives you more information. Now, there's different ways that you can track your diabetes. When you're tracking your diabetes, it's because you want to make sure if it's going away or is it getting worse. This is my daily blood glucose log. It is a log where you pretty much is writing down the information you get every day from your thermometer, your tester. You have every day. You do before breakfast. You do after breakfast. Before lunch and after lunch. Before dinner and after dinner. And you check your doses before you go to bed. And if it's high, you take your insulin. If it's low, then you just take your pill. And this is just an everyday thing. Everyday log that you would do. Okay? Having diabetes is really important because you want to monitor what you eat and how you eat it. They will give you this little brochure. It's like you can go to this Mercy Hospital. You can go any type of hospital that you're, assigned to, but Mercy is a very good hospital if you're a beginner. You can have individual nutrient therapy session about eating patterns, grocery shopping habits, personal nutrient history, and counseling and education. And this will pretty much help you with your everyday life. So, this is the hard part that all my patients get when they first become diabetic. This is your tester. So they give your tester in this little bag. Just pop it in your purse. You can pop it in your purse or your bag, anywhere. So it's a really good source. You open it. This is what's inside. You have your tester, your tester here. This thing gives you, it helps you monitor your sugar. This little dot that's blinking, that's where you will put your test strips. And I'm going to show you what your test strip will look like. This is where your test strip will be in. It's just a little tube, and it has millions of them in there. You have 50 in each container, and you will have this tube. Now this tube is different from other tubes because this one has this little part. I don't know if you can see that, but this is just a part you can take out like that. This is what you stick in here. You just stick it in. And you close it. Okay. And then you close it. This is when you stick yourself. You push this little button, just like a little pin, and you stick it. And that's pretty much how you will use your test strips. And then you just close it back. Just close it back, set it in your purse or your bag, and you're good to go. The next step of being diabetic is the insulin. When you're putting your insulin, you always want to keep these alcohol pads. Dropped a few. These little test strips, they are to clean up the area before you put your insulin. You don't want to put your insulin in and it's not clean in that area because it can affect the insulin and the insulin won't work right. And that will affect how the insulin will work in your body. But these are little alcohol pads. What you do is you take one little alcohol pad and you wipe it on your finger, or if you're doing your insulin, you will wipe it on your body. But these are the parts that I want you to go for when you're doing your insulin. Okay? I'm going to show you. This is your stomach. Okay. Now, I'm going to show you where the parts that you will do your insulin. The part that you will put your insulin is in your stomach. You will put 1, 2, 3, 4. Then in your leg, you will put 1, 2, 3, 4. Make sure that you do like a round cycle because you don't want to put the insulin in the same spot because it can damage your skin. So you do want to make sure that you have your insulin in a circle motion so it won't affect your body. Because too much insulin in one spot can be really bad. Now, when you're doing your insulin, it will come in a pack like this. In a pack like this. And when you open it, it'll have your insulin inside of it. Just like this. And this is what your insulin will look like. Just like that. Then you have this part right here that you can turn up. And for example, say if your doctor give you an insulin that's 20, you will use this little part right here, and then you will turn it all the way to your number, and then you'll push this part right here. Once you push this part, the insulin will come out of this part with the little needle. Okay? And this will be this is what your needle will look like. Once you use this needle, you put the needle on here, just like that. You start up your insulin level. If it's 20, you turn it all the way to 20. And when you're ready to put the insulin inside your body, you push this little button right here, this right here, and it's just like the tester. You go like that, like it's a pin, just click it like that, and your insulin will go in your body. Now, it will burn a little bit, so when you do it, you want to fan that area, blow it any type of way that you can put a little breeze on it, and you will enjoy it. This is what it will look like right here. The DB Ultra Fine Pin Needles. Now you might have a different pack in different areas, but if you come from your doctor, he'll probably just prescribe you with this type of needle. And this one little pack is your tester. It is just a bunch of testers that you can use in your tester that you will have to stick yourself in there. So, do you have any questions? No? Okay. I will send you home with these. These are your nutritious books, and it will make sure that you are pretty much treating yourself right. It's not going to affect you anyway. So I wanted to relax you a little bit. make sure that you understand what diabetes is. And you won't be so nervous about it. As long as you take care of yourself, you will be fine. And I hope that you will find this video very useful. So, thank you. And I hope that you'll be doing fine. And I want you to stay safe and healthy. And I hope that all these information helped you a lot. Thank you. And hopefully I'll see you soon.